It's Wednesday, March 26th. I'm getting ready to go in for my third night shift on the COVID unit. We are working through some of the procedural questions that we have as a team. So dirty areas, clean areas, how do you decontaminate when you're at work? How do you take a break or go to the cafeteria without making areas dirty? How do you get in the car without totally contaminating your car? Can you put kids in it once you've used it? And then, as I discussed in an earlier video, my husband and I last weekend went through and finished making sure our will was up to date, that our power of attorneys, designated power of attorneys, were aware that they are, and knew where the paperwork was, that our children had agreed to kind of who would be their guardians if we aren't here to be with them. These are real discussions that all of the care providers that I know who are working in the COVID units are having right now. And if they weren't, they're realizing that they should. It's disturbing. 23 doctors in Italy have died so far of the COVID virus, and clearly there are young people, healthy people throughout the world who are dying of this. So the concern is real. And we know as a state we're almost out of PPE. That's personal protective equipment. We use it every time we go into the unit, and we're not using enough. When you look at what they're doing in China and what even the grocery store workers are wearing in Italy is better than what we're wearing when we go in to see our patients right now. It's not enough. We know that the virus can live on surfaces for up to 3 days or even longer by some studies. Whether or not those have been validated, I don't know. So we're all concerned. These are uncertain times. We're working through crazy questions. How are we going to supply ourselves with the protective equipment that's absolutely necessary in a setting of a government that won't enact the legislation necessary or the executive orders necessary at the federal level to get industry to really help us. And the ventilators are coming next. It's possible that we're flattening the curve in Oregon, and I hope that's true. I hope that we never have to do the things that we're talking about doing, but we've got to protect our healthcare workforce. All of you should care about protecting the healthcare workforce, because if we aren't here to take care of the ventilators and lead these teams, those are skills that are not straightforward, and we are going to be proning people and doing things that's not standard. Even our teams that are really experienced are going to have to practice. So please, if you are listening, advocate for the DPA to be enacted at the federal level and to get PPE ventilators especially made once we get the PPE that we need, which I hope is on the way. We need hospital beds, we need field hospitals, we need step-down units, we're probably going to need to use dorms. So how at the state and the federal level do we liberate those resources? It's going to take citizens asking, demanding for these things to happen. So I hope you will. Please use your voice, because we are going to continue to go to work. I'm leaving in 2 hours, exposing myself to the COVID virus every day in a way that I don't think is optimal, so that we can take care of you. And so please, we go to work for you. Please go to work for us. Thanks.